Look closely at the overlapping geometry of this wrap. When applied correctly, a bandage forms a secure, protective shield over an injury, keeping the primary dressing exactly where it needs to be. This is the open-wove bandage, often called a WOW bandage, manufactured by Cotton Craft Private Limited. It is engineered to meet strict BP Type 2 medical standards. The roll is designed around a specific mechanical requirement. It must provide firm, unyielding stability to the wound site while applying absolutely zero compression to the surrounding tissue. To perform this application, gather your open wove bandage, a sterile non-adherent pad, standard medical tape, and a pair of medical shears. Mastering this non-elastic application is necessary to lock a dressing in place without the risk of restricting the patient's blood flow. Step 1 is selecting the correct width. For an adult forearm, a 5 cm or 7.5 cm roll provides the correct coverage without the material bunching or folding. The bandage is composed of 100% pure natural cotton yarn. It is woven with low linting edges to minimize loose threads that could interfere with the application. This bandage functions exclusively as a secondary dressing. Because the weave is designed for breathability rather than non-adherence, the cotton fibers must only ever be applied over a primary barrier. Place your sterile primary pad directly over the injury site. This pad serves as the actual barrier against external contamination. With the pad held in place, begin the anchor wrap. Start the roll a few inches below the primary dressing, on the section of the arm closest to the hand. Complete exactly 2 straight overlapping revolutions. Do not pull the material. The natural friction of the cotton fibers will lock the fabric to itself, securing the start of the roll. By utilizing the fabric's own friction, you establish an immovable foundation without needing the inward tension of an elastic wrap. Once the base is secure, use the ascending spiral technique to advance the material up the limb. This diagram shows the path of the spiral. Angle the rolls slightly upward so that each new revolution covers exactly 50. As the spiral covers the dressing, the bandage utilizes its open weave structure for maximum breathability. The loose square gaps in the cotton grid allow heat and moisture to pass upward and away from the skin. This continuous air circulation keeps the skin cool and prevents the moisture buildup that leads to maceration during the recovery period. Once the primary dressing is fully covered, complete a final straight revolution. Use medical shears to cleanly sever the bandage. Tearing the material by hand will fray the low linting edges. Secure the cut end by applying medical tape across the flat cotton. Avoid using safety pins to eliminate the risk of accidental skin puncture. The combination of the 50% geometric overlap and zero stretch application creates a breathable shield that holds the primary dressing immobile. With the physical wrap complete, you must now perform the mandatory circulation check. Isolate a fingernail on the treated limb. Press firmly on the nail bed until it turns white, then release. The check is successful if the pink color returns to the nail bed instantly and the patient reports zero tingling or numbness in their fingers. If these conditions are met, the limb is correctly protected. The once vulnerable primary pad is now held in place by a secure, professional-grade outer layer. To maintain your supply, store all unused rolls in a cool, dry, and dust-free environment. Ensure the individual packaging remains clean and intact. Maintaining the package seal is the only way to preserve the bandage's clinical integrity. Reliable wound care depends on consistent materials, provided by manufacturers like Cotton Craft Private Limited. Following these structural steps ensures that a roll of pure cotton provides the precise, non-compressive support required for clinical wound care.